First aid and cardiopulmonary resuscitation, also known as CPR, are essential skills to have. CPR involves giving chest compressions and rescue breath to provide oxygen to the body and brain. By performing CPR and administering first aid, one can help to buy time until medical assistance arrives at the scene of an emergency. Medical experts strongly advise individuals to take first aid and CPR skills seriously to save lives. Mr. Sanni Abdulmumuni, a first aid trainer with the Nigerian Red Cross Society, explains simple steps to help an unconscious person during emergency situations.
Basically, there are 10 medical conditions that can lead to an unconsciousness. We are looking at things from fainting, imbalance of body heat, we are looking at shock, we are looking at head injury, we are looking at epilepsy, poison, and like I said, a whole lot of them, diabetes, and a whole lot of them. But you know, the most popular one in our midst as a people will be fainting and drowning, especially. Because for fainting, the first thing people will tell you is pour water on them. And we always say fainting is just simply as a result of insufficient blood supply to the brain. Probably this person has been sitting for too long or standing for too long. So the blood that's supposed to flow around towards the brain is flowing around the lower part of the body. And so when this happens, the casualty becomes unconscious. And so the best bet is that for most people, like I've said, they fail. When you pour water on such casualties, you tend to revive them. But unfortunately, you even worsen their case when you pour water on them. So what is the best bet? The best bet is simply lie them down, raise their leg, because I said blood has flown to the lower part of the body. Raise their leg, blood will flow back to the brain, and in a few minutes, this casualty is fine and ready to go. So when you pour water on them, it usually worsens their situation. Then for drowning, because of the fact that so many people are again looked at drowning as once the person is drowned, water is in their stomach, you want to get water out, and they feel that is the best way out of it. Again, drowning is not water in the stomach, it's not water in the abdomen, it is simply water taking over the role of oxygen in the lungs. What you should have in your lungs is oxygen and not water. So when people drown and water is taking over oxygen in the lungs, then we say the casualty has drowned. What is the best way out? The best way is, there are two scenarios that could happen to a drowning or a drowned casualty. The first is that if they are conscious, bring them out of the water, they are conscious and still breathing, just put them in a comfortable position, dry them up and keep them warm. With this, while they are kept warm in a comfortable position, you are calling for medical attention so that they can do further checks on them. When they are brought out of the water, for example, and they have become unconscious, again, two scenarios may happen where they become unconscious. Number one is that they could become unconscious and still breathing. Where they are unconscious and still breathing, just simply place them in a recovery position. And again, I always tell people, don't compress the stomach in an attempt to get water out. You tend to worsen the casualty situation. So what do you simply need to do? Just place them when they are still breathing. Just simply place them in a recovery position. Water will find its way out of all the natural openings in the body. That is, water will flow out through the nose, the mouth, the ear, and every other natural openings in the body. Water will find its way. Naturally, if water finds itself where it's not supposed to be, it will find its way. So just when you place them in a recovery position, it will come out on its own. That is where the casualty is breathing. But where you find out after doing your assessment, you find out the casualty is not breathing, what do you need to do? It's simple. Just simply commence CPR. Lay the casualty on their back, give 30 chest compression. The chest compression should be on the casualty sternum, or simply put, the breastbone, which is in between the two breasts. When you place the hip of your palm on the sternum, bring in your other hand, lock it up together, and compress downward, having a locked elbow, straight elbow, compress 30 times, and give 2 rescue breaths afterward. What is the essence of the compression? The essence of the compression is that, don't forget earlier I said, the heart has stopped performing its primary function of supplying blood to the brain. But between that timeline of stopping that function, there is still a reserve blood in the heart. But because the heart is no longer playing that role, it can no longer supply blood to the brain. So your compression helps to continue circulation of blood to the brain, keeping it alive until the casualty either starts breathing again or until help finally comes. So for rescue breath, this is not totally compulsory that you must give the rescue breath. It's not totally compulsory. If you feel you don't feel comfortable giving the rescue breath, for adults especially, please focus your attention on just giving the chest compression. And you have a target at the back of your mind. You're targeting between 100 to 120 chest compression every 1 minute. What this simply means is that you want to give 2 compression in every 1 second. So when are the times you need to stop compression? Stop compression either in any of these 3 situations. Number 1, when breathing is restored, please stop, because you are compressing the heart, the chest, because the heart is no longer supplying. So once breathing is restored, it means the heart has started working. Stop. Number 2, you have called for help, medical backup, and they are here. You have an ambulance. Please stop and hand over to them. Don't be the superhero. Once they are there, give them their job, and they carry on from there. Number 3 is, once you find out you are tired at any point in time with the compression, please stop, because CPR can be very exhausting. It can be very tiring. So that you as a first aider do not also become a casualty yourself. If at any point in time you are tired, stop, take a rest. If there's anyone around, allow them to help you continue with the compression. Those are the 3 scenarios when you stop. And this is specifically for adults, because children and infants can also become unconscious. All of those medical conditions I have mentioned earlier on can also happen in infants and in children. So what do you need to do for them? It is compulsory that you give them 5 initial rescue breaths. Now for them, most times when they stop breathing, it's not as a result of the malfunction of the heart. It's mostly as a result of probably a blockage in their respiratory organ. So you need to give them 5 initial rescue breaths. After giving them the 5 initial rescue breaths, your next other function is to start the compression. For a child age 1 to say age 5, 6, you give them compression using only one hand. Why? Because their bone is still developing and you don't want to cause them a fracture. So you just one hand to compress, still on the sternum for 30 times. By the time you're coming back to give rescue breath, you're giving only 2. Don't forget I said 5 initial rescue breaths, 30 chest compression using one hand, 2 rescue breaths when you're coming back to give the rescue breath. The same target, 100 to 120 chest compression. Then for infants, because again their own lungs is also developing and you don't want to blow in air to cause them any harm. You want to puff air, just give light air. And when I say infant, I'm looking at age 1 and below. So give them puff of air 5 times, give 30 chest compression. This time again, don't use the entire one hand, just use 2 fingers still on the sternum and you compress downward 30 times. And once that is done, by the time you're going back to give the rescue breath, you're giving 2. So reverting back to 30 to 32, but with an initial 5. Again, I think it's very instructive I say that for CPR to be effective, it must be done on a hard surface like the floor or on a table for infants. But for adults, it is more effective on the floor because you want to have that pressure between the chest and the heart so that you have that circulation of blood to the brain.
He urged Nigerians to shun the rush to post on social media and learn first aid to increase the chances of survival of casualties.